Evaluating students in the clinical environment is multifaceted and may seem subjective. Research shows that clinical instructors need guidance and support in grading, and that they may often feel isolated and alone during their clinical placements. An anecdotal note template could be used to help increase inter-rater reliability and cue clinical instructors to observe pertinent behaviors throughout the day. Just as a nurse may use a nurse brain sheet in order to keep track of key labs and vitals and assessments of their patients, an anecdotal note template could be a ready reference to ensure clinical instructors are noting key behaviors and critical thinking from their students. You may consider an anecdotal note template with your school's specific course objectives for your clinical courses. For the purpose of this professional development training, an anecdotal note template was created by the researcher and should not be used without permission. This particular anecdotal note template is based off of the most current research in nursing education. This includes the NCSBN Clinical Judgment Measurement Model, which the next-gen NCLEX is based off of. With that next-gen NCLEX and the CJM, they use terms such as noticing, interpreting, responding, and reflecting. Therefore, those particular terms were used in the template. The NLN, Clinical Nurse Educator Competencies, asks that all clinical instructors be competent in effective assessment evaluation strategies. This particular template also includes the QSIN competencies of patient-centered care, teamwork, evidence-based practice, safety, and informatics, and the 10 new domains in the AACN Essentials concepts.